Cardiologists and cardiac surgeons both work together in harmony to treat complex conditions. Typically, cardiologists end up diagnosing certain heart conditions. When those conditions become very severe, often it requires surgical expertise. In an ideal world, cardiologists and cardiac surgeons talk about different treatment modalities, some that are catheter-based and some that may require open heart surgery. And we can discuss the pros and cons of both. Often there are multiple potential treatment modalities. It's nice to provide individualized and comprehensive care when we have a great working relationship, as we do. Sometimes patients who are having heart attacks don't have the classic symptoms. And particularly if you have diabetes or if you're a woman, you don't have the classic symptoms. Sometimes they can be very subtle, just a little bit of discomfort in your chest. Sometimes you may even think it's gastric reflux. And sometimes you can just have shortness of breath or feel like you can't quite catch your breath. And sometimes it can be pain in your arms. Sometimes it can be pain in your neck. But it's really important for you to be evaluated by your physicians so that they can determine and ensure that your heart is doing okay. Lots of things that you can do as a patient to prevent your arteries from becoming clogged. There's quite a few lifestyle interventions you can start making today, and that includes eating a heart-healthy diet, so avoiding processed foods, cutting down on the amount of dense caloric and nutritionally exempt foods. And other things you can do are avoid smoking and then also getting a moderate amount of exercise several times a week. If you have diabetes, it's very important for you to control your blood sugar because we know that can accelerate the progression of heart disease. The best way, if you have concerns about your heart health, is to establish care with a primary care physician if you don't already have one. And that primary care physician will do an excellent analysis of your perceived risk factors from heart disease. And if they're concerned whatsoever, they will order some testing, sometimes a stress test. And that may lead to further interventions, other tests such as electrocardiograms, echocardiograms, perhaps coronary angiograms. Everybody's risk profile is different. And so it's important to start with your primary care physician, and they may order some more advanced testing as they see fit. Mitral valve disease is a disorder of the mitral valve, which is the valve in between the left atrium and the left ventricle of the left side of the heart. The heart has 4 chambers, and the mitral valve is in between the left atrium and the left ventricle. And the mitral valve itself, I always describe to people, has 2 main leaflets that open and close. And the leaflets are supported by different cordal-like structures, and they kind of look like a parachute. Sometimes one of those strings or cords can break, and that can lead to mitral valve prolapse. That is a condition that, without correction, can lead to heart failure and progressive symptoms. So it's important that if you get diagnosed with that sort of condition, you need to be evaluated by a cardiologist and likely a cardiac surgeon as soon as possible. There are various techniques for repairing mitral valves. One common technique is when those cords or strings of the valves break, we can restore the normal geometry of that valve by using a piece of suture, typically made out of Gore-Tex, to replace that area of the valve, and that retains the normal valve structure. And then to provide additional support, what we typically do is we can sew on a ring around the valve to help support it. Sometimes there is an area of the valve that is too enlarged or too stretched out. And sometimes we can simply cut out that part of the valve and then sew it back together. So it's a very tailored and individualized approach to treating mitral valve disease.